Hello and welcome to How Would You Rate Your Pain? We will be exploring life, loss, love, and the power of resilience. I am Dr. Tiffany Bartell. Thank you for listening, and I can't wait to go on this journey with you. Hello and welcome to another episode of How Would You Rate Your Pain? I am Dr. Tiffany Bartell, your host, and we will be exploring life, loss, love, and the power of resilience through this podcast. But today, we are talking to two of my friends, Carrie and Brandon, who are therapists in the field, and we're going to talk about what it's like to be a male therapist, kind of their journey to getting here. And when I was doing a little bit of research for this show, I was looking up statistics, and 70% of the counseling field is filled by women or female practitioners. Does that sound about right to you guys?
Yeah.
Yeah, is that what you
Pretty
see?
spot on.
Yeah. And about 25% is male. And so so I think you guys just have like a really unique perspective. And I know as a therapist, it's so helpful to have, male therapists to send, our young men to, or even our old men to, where they can have that special perspective and connection. And so I'm really excited to have you guys here today. Before we start, though, why don't you guys tell us a little bit about yourselves and what you do and anything you think it would help our listeners to know?
Okay. Well, I guess I can start. Yeah. So my name is Brandon Grentz. I'm a licensed therapist, and I work at a private Christian college, Southern Adventist University. And I've been counseling for I think this is my third year. Yeah, going on my third year. So it's been fun so far, but that's kind of a brief introduction to myself.
I love that.
Awesome.
Yeah. Okay. And Carrie,
Yes.
how about you?
Hey, my name is Cary Bayless. I am at Henniger Counseling Center. I have been in the field since 2018. Started off in a psychiatric hospital.
Which is where we met.
That's where we met.
We were both working there. Yes.
And then transitioned into private practice in the height of the pandemic in 2020.
Wow.
Just figured it was a great time to make a change, and I love it.
I love that. Yeah. So I'm really curious, what is this you guys' first careers? You're both a little bit young, or like what was kind of your journey to getting into therapy?
Yeah, I can jump in there. So prior to my career as a therapist, I worked with homeless services in the Chattanooga area.
Oh, wow.
So during that time, I worked at a local nonprofit called Family Promise as their development and marketing director.
Okay.
So, I loved being able to raise money for our clients at Family Promise because I cared about the people. Mm-hmm. But the longer I was in that role, the more I wanted to actually connect with people.
Yeah.
So that's
like help on a different level.
Exactly.
I love that.
A more personal level. So that's when I made the decision to go back to school to get my master's, and here we are.
Here we are. That's so interesting because I haven't mentioned it in the show before, but I wanted to help people. I like people. And so I was a business major and I was going to school for human resources because I was like, I want to help people. This will be great. I'll help them find like their job and mentor and grow them and give them all the resources they need. And then while I was in college, I started working in human resources, and it was like layoffs and insurance benefits and, employee disputes and complaints. And I was like, oh man, like this doesn't feel like my place in the world. And so kind of like you, I kind of took a little bit of a windy road.
Yeah. A little bit of a pivot.
A little bit. Yeah. Still helping people. Just hadn't figured out what that looked like. How about you, Brandon?
Yeah, for me, it's funny because counseling wasn't really actually on my radar initially. I first started going to school kind of similar to you as a business major. So I actually started school with a business major with a emphasis in marketing and management. So I thought I was going to do something in marketing. I loved the creative process of that. But the more that I got into it, the more my classmates just seemed to be a lot different than me. So I felt kind of, I guess I stuck out a little bit compared to my classmates. Like, For example, we took the Strengths Finder test. Kind of tells you strengths about yourself.
Yeah.
And when we took that, I remember I had like empathy and like individualization and a lot of like relational ones.
Empathy is like your number one,
Yeah, empathy
right?
is my number one Strength Finder strength. And then, but everyone else around me was like, I'm like a driver, like an achiever. Like, I don't really care that much about your feelings as long as things get done.
Okay.
And so, not that people with empathy can't be in business, but the more that I was in it, I just wasn't really finding my niche, I guess.
Yeah.
So then I actually, after I graduated, my school actually allowed me to come back. They had a guaranteed education program that actually allowed me to come back for a second bachelor's for free.
Oh,
So
wow.
I took advantage of that.
Yeah.
And I came back and I got a religion degree with a focus in pastoral care, because I thought maybe I would do some kind of like young adult ministry or something like that.
So people helping, you
yes.
still kind of like that
yeah,
journey.
still involved with people.
Yeah.
Still wanting to connect to people, but I also had gone through a lot of my own mental health struggles with anxiety and things like that. So I wanted people to know like, hey, you know, it can get better and you don't have to do that by yourself. So then when I was in the religion program, I took an intro to counseling class, and then kind of the rest is history. After that, then I went to get my master's degree in counseling with clinical mental health focus. So I kind of took the long route too. So yeah, it wasn't initially something that I thought I would do, but here we are now.
Yeah, I love that. And I think as a professor, I do a little adjunct work. A lot of my graduate students, you know, very few of them is this their first career.
Absolutely.
And I feel like there's something really valuable about that, of having exposure to different worlds and having to find yourself and find your place, because it gives us so much of that, like, empathy, you know, but it's like practical empathy of like, oh man, I have been through that. I know what it's like to like be, you know, I mean, we kind of sell this idea that at 18 you should like already have figured out what you're gonna do, and I'd love to see, you know, the data on that of how many people, I know it's out there, but how many people are actually doing, you know, that. And it's okay to kind of take your time, because it's not time wasted. You end up places right on time for how you are mentally and emotionally and experientially.
For sure. And I think sometimes too, the things that I learned when I was doing business or religion or anything else, I can relate to more people because I had those other experiences and bring some of those concepts into counseling. So I agree with you on the it's not wasted time, because I take concepts from those things all the time in my sessions with clients. So it's kind of cool to see that too. The world's kind of colliding in my history.
Yeah. I like that your Venn diagram like creates like a nice space for maximum help. And I'm sure for you, having to, you know, resource and you know, be able to kind of sell people that motivational interviewing that you have to do when you're fundraising.
Absolutely.
That translates so well.
Directly. And my undergraduate degree was actually in creative writing. So story is a really big driver for me. It's one of my favorite parts about the Bible is just the meta-narrative of the gospel. And studying creative writing in undergrad, I thought, well, I guess I'm going to have to be like J.K. Rowling and really hit it big to make a career out of this. But what I found through that degree was everybody has a story, and everybody is deserving of health. So it's really cool in retrospect to look back at how the Lord is just, his hand has just directly guided us from business or creative writing or marketing, development, whatever it may be. It's all brought us to a place where I think we're better equipped to help people.
Yeah, you're helping people kind of figure out their own story.
Right.
What's happened, what's happening, what would you like to have happen? So that story arc isn't quite complete, you know, when you come to therapy, but I think it's a lot easier to kind of think about the future and work on the present when you understand. I mean, you could tell I'm a little psychodynamic, you know, you know, but I do think that, like, you know, if we don't understand what's happened so far, it's really hard not to keep repeating those cycles and that story. Yeah, and have it turn out differently. So how was it for you guys being in grad school? What was that process like for you? You both have these different backgrounds and kind of going into learning this work.
Well, I can definitely say the statistics of majority females being in this field were also true in grad school. I was one of 2 guys in my entire cohort.
Oh, wow.
Yeah.
Okay. Oh, wow. You guys are so brave.
Yeah, so
wow.
that was honestly one of the biggest blessings, I think.
Okay.
It really pushed me out of my comfort zone a little bit.
Yeah.
There were so many jokes all throughout grad school of, oh, like, you're going to find your wife here because there's so many wonderful women in your program. And, we tried to avoid that, but
yeah, that's so smart.
it was hilarious. One thing that always stood out to me were my male professors. There was a gentleness and a strength and a comfort from, honestly, all of my male professors. I went to Richmond Graduate University, cannot sing its praises highly enough. And I remembered consistently throughout my time at Richmond thinking, that is an example of biblical manhood. That is what I would love to be able to bring into the counseling session myself. Yeah.
Yeah. How about you, Brandon?
Yeah. So, the grad school experience for me was really cool. I too was one of two males in the class.
Do you guys like bond and stick together, or are you just like every man for himself? Like, we got to make it work in this cohort.
I think we related. But honestly, I feel like I was in a position where our cohort was actually really tight knit. Because I think there was maybe 12 of us or so, and I actually liked the fact too that it was a small cohort because we could really relate to each other. We could really get vulnerable in our classes because honestly, a lot of the first year classes is just doing your own work, like making sure you have your stuff figured out before you go help other people.
I hope you guys hear that.
Yeah.
If you're going into counseling, you should do your own work.
Absolutely.
For sure. Because so a lot of it was reflection or, asking yourself the hard questions of like, who's going to be the hardest person for you to work with and like those kinds of things.
That's good.
But I love that I had like a group of people that went through that cohort with me that I felt like were pretty much family. Because we still have a group chat of everyone in my cohort. Like, as recent as yesterday, we were chatting in our group chat that we have still.
I love that.
But I love that it was kind of like a family atmosphere, and I love that the small class sizes also allowed us to really dig into the professors, and you can tell that they really just want you to be the best therapist that you can be. So I really enjoyed that aspect, and that we really did have a safe place to kind of dig in and do some of our own work and encourage and support each other while we were learning the skill sets. Because I think that's another thing too is you might kind of set this expectation of, well, if you're the therapist, you should be comfortable going into the sessions and not be nervous yourself, and it's like we're human beings too, especially when we're learning. Like, I remember my first session, I was just so nervous. I was like almost having an anxiety attack myself. So, so
I think there's many people who can relate to that.
Yeah, exactly. Right. So I was kind of like, what if I say the wrong thing? So
or what do I say next?
Exactly. Right? So you learn, you practice a lot of the skills on each other, but then nothing can 100% prepare you for when you go to that first session. But again, I just love that everyone was there to really encourage and support.
Yeah, I remember when I was taking process and techniques, we started off with role playing in front of the class before we had to videotape,
rough.
Our triads, and it was just like learning anything as an adult, like so clumsy. We used to live in Idaho, and we would ski every Thursday because we lived kind of at the base of a ski mountain. And I remember, my kids were really little and they had the little helmets on and they were learning how to ski. And there was this guy who was in the beginner's class who was probably over 6 feet tall. And just watching him like windmill down the bunny slope, I was like, that is so far to fall versus the kids, they just kind of flop 2 feet over, And so I think there's a lot of vulnerability and a lot of bravery that it takes to just like get up and try, get feedback, try again. Because we all want to come in to things as adults already knowing how to do it. Like, I'm going to nail it the first time.
Yeah.
Why would we think that? Why would we think that we could nail anything that's skill-based the first time?
Sure.
So, yeah, I think that it's really important to have, like, safe cohorts and professors that you look up to. So Brandon, I'd love to like pull on a thread that you mentioned,
Sure.
and you guys can always decline any question. But so what were the clients that you thought would be the hardest for you to work with as you feel comfortable? And has that actually played out? Or because I think that's one thing that's important for especially people who are thinking about coming to the field is you have to know yourself. And you might learn yourself. I remember when I graduated, got my first job, they were like, what's your demographic? And I was like, I don't know. Like, I just got here. I haven't seen enough people. I think it asked me in a year. Like, I don't know what my demographic is. And it was very different. I always thought I wanted to do children, and then saw some kids and the kind of things that kids were coming in with, having children of my own at the same time. I was like, I don't think this is for me, and so you kind of have to navigate that. So it ended up being really different what I thought I was going to do versus...
Isn't that the way?
Yeah. So how about it for you guys?
Yeah, I mean, so I guess, I remember trying to answer that question. And I know for me, a lot of it was just, I thought the people that were going to be hardest for me to work with were people that were intentionally hurtful. So, people that were abusive on the abuser side, people that were the ones who were perpetuating harm to other people. Because I was like, man, I feel like that'd be really hard to relate to, because it's hard for me to get to how could anyone hurt someone like knowing that they're hurting someone kind of a thing.
So think about sitting with them and being empathetic and like warm and
exactly right. Because I've talked to so many people on the other side of that. I know what kind of damage can happen from that. So for me, I was like, man, that'd be very hard for me to deal with people that, especially if they were kind of unremorseful, or they were just like, well, this is how I am, and if people don't accept it, then that's tough for them. So, and did I run into that, I guess, was the second part of your question. Honestly, me working in the college setting, I haven't run into that too much, actually. There have been a couple of times where people have come in and they're just like, everybody else is the problem. I'm perfect, and it's kind of like, okay, well, maybe there's a little bit of a lack of insight there. So those can be kind of hard to get people to see. Like, how do you make people see that when they don't? But for the most part, I haven't really had to deal too much with like, people that are abusers or things like that. That's more, I think, probably in the community mental health setting, which I did run into some of that when I was doing my internship. But so far in my, in the college setting, I have a little bit more of a, I guess, like a homogenous group of people. So I don't see that as much. Yeah,
that's a really good point. Where you work determines a lot of the population that you're going to end up seeing. And this, you're not going to want me to say this because you're so humble, but Brandon's actually one of the, most praised counselors, where in his setting. And I don't even like really work there. And, and I always hear really good things about the work that you do in that place. And it's important, right? That emerging adulthood, there's so much that you could do. And that period's so difficult. So yeah, I like that. How about you, Carrie?
Yeah, great question. So I remember it was right before I actually started my master's program. I actually had a friend die really tragically, really unexpectedly.
I'm so sorry.
In a car crash. Thank you. And that was a big capital T trauma for me personally, for our friend group as a whole. So when I first started counseling for myself during that time, I was like, there is no way I can work with trauma. This is going to touch way too close on my own story, on my own wounds. Thankfully, one of the things that we learn in grad school is what countertransference is, what it feels like, how we sit with it. And through prayer and through gentle nudges from the Lord and from trusted friends, I actually decided to take the trauma track at Richmond and specialized in it.
I love that.
So something that I thought was going to be too close to one of my own wounds has actually become such a passion of mine because I've seen and personally experienced the power of healing that can come. But a second demographic, I remember growing up, the movie Sixth Sense came out. And there's a scene in the movie Sixth
I have never
Sense.
seen that because I think I thought it would be too scary.
It's very scary.
Yeah, I don't do well with scary things.
Do not recommend. But there's a scene in the beginning where someone who's struggling with psychosis breaks into the therapist's house, and it's really scary. And I think I was in, goodness, maybe 6th or 7th grade when I watched it.
Yeah.
Sorry, Mom and Dad. I don't know if y'all know I watched that young. I'm sorry. But it scared me so bad.
I bet.
And I thought, psychosis, that feels so scary.
Mm-hmm.
And then...
You know what I'm thinking right now as you're saying that.
Yes.
Because I know what you love.
Then as the Lord's hand guides our path, during my time in my internship at Park Ridge Valley, I was exposed to a lot of clients who suffer with psychotic symptoms.
Yeah.
And the shame that I felt for my preconceived judgment really set a fire in me for, I need education on this. This is not a demographic of people that are scary, that are demonized like it's portrayed in Hollywood, like in The Sixth Sense.
Yeah. Just people.
They're just people.
Yeah.
The brain is an organ like every other organ. It gets sick too.
Yeah.
So it's really interesting. Again, in retrospect, the two kind of areas I did not think I would specialize in are actually my top 2 presenting clients right now. Those are the areas I work with the most.
You're good at psychosis.
Thank you.
I know poor Carrie, he's like, okay, Tiffany, my caseload's full. So many referrals. I love them so much.
I love it.
Yeah, but I think that your level of comfort with it shows that you did do the work. And I think that's one thing as therapists, that if there's something we don't understand or we feel uncomfortable with, maybe it's not for you. There's some things that I don't do geri psych, and then I also don't see children because I often pack my days and it's too much context switching for my brain, but if there's something that's a condition that you're just unsure of, go towards it, turn around and face that fear, and education's really the key. And then, that countertransference is really important, because if we're afraid, think about how they're feeling as they're experiencing it.
Yeah.
And so I always tell my students, countertransference is useful. It tells you how other people in this client's life are experiencing them. Sometimes it tells us what kind of work we still have to do, which is fine, because we're human and we're growing too.
Amen.
But I like the way that you kind of ran towards that, because you are working out in the community, and people don't want to treat those conditions.
Right.
And so I love that. So as you think about your development as therapists, what have been the key people or key moments for you that you think really helped you to kind of, deepen and develop as a therapist?
I can jump in on this one.
Go for it. Yeah.
I think that, so during internship, I did half of my internship at Henniger Counseling Center in a private practice setting.
Yeah.
Half at a local psychiatric hospital.
Yeah.
So there's a big difference between those two settings, almost night and day.
Yes.
And they are both wonderful, they are both needed, they are both necessary.
But two very different parts of the same process.
Absolutely.
So different.
Absolutely.
Yeah.
And I really credit my time at the psychiatric hospital, because I did work there after I graduated for a season. And because of my training in trauma, I got the blessing of getting to work with a lot of individuals who had significant chronic trauma.
Yeah.
And the hospital setting, being able to be in treatment team with well-educated psychiatrists, with nursing staff,
they have a good team.
with our techs, with the passion of the cafeteria individuals. That setting, I always say, that's what gave me both my backbone and my soft front.
I love that. Say that again, Carrie.
Yeah.
It gave you what?
It gave me my backbone, so my strength to be able to sit in hardship with people, and also the soft front of being able to welcome people in.
I love that.
Not being scared.
Yeah. Yeah. To like lean in.
Absolutely.
Yeah. I love that, you know, and having exposure to the hospital setting, because we have similar, you know, we worked in private practice. I've worked in a college setting, you know, and the psychiatric hospital. And I have to say the same thing. I almost think for everybody who can, just even like your practicum or your internship or part of your residency, something, because it's good to be able to tell your clients, if you have to admit them, what it's going to look like, what's going to happen.
Yes.
And then also, you know when to send them. You know what they're going to get admitted for and what they're not.
Absolutely.
And, you know, I think that's so beautiful. I love that. How about you, Brandon? Like, what are some of those like impactful moments or people for you?
Yeah. So for me, I actually have an interesting story too, of how, again, so I think it started that I took multiple degrees before I went to counseling. And then it's funny. So I've told people my story. I'm pretty open with it too, because I think it kind of sheds some light on things that can be scary. So basically, so as I was finishing up my counseling program, so you have to do an internship for, I think it's 600 hours. It's quite extensive.
It's big. Yeah.
Right. So you have to do a big internship at the end. And I ended up doing an internship. I chose a community mental health agency to do my internship at. So basically, long story short, some of my own anxiety popped up again as I started that. And I was actually only there for maybe 3 weeks. And I had some experiences where I guess I wasn't quite ready, or some stuff just popped back up for me with my anxiety.
Well, and then you mentioned too, there wasn't a lot of like oversight or like clinical support
so what happened
on the
was
ground, which is not the way it's supposed to be.
Right.
Yeah.
So what happened was the place that I got sent to, it was a new place that had just opened. They hadn't quite established their practices yet. And so a lot of my supervisor, who was supposed to be there kind of mentoring and guiding me, when I first started, was still on vacation. So they weren't even there yet. People kind of came in and out who were able to help me and kind of supervise me. So it was just kind of a perfect storm of a lot of things just kind of fell through the cracks with my experience. And so unfortunately, I kind of just got thrown into the fire. So it was kind of like, hey, you're the intern, you're free. So we're just going to send you every client
Whoever
that can't pay. Yeah.
Yeah.
And so,
not vetted, not seeing if it's appropriate.
and it's like a lot of them, though, unfortunately, a lot of the people that I was seeing were people that needed a lot of help, couldn't afford it, but they also had some pretty severe presenting concerns that were happening. And I was like, I'm an intern. Like, I should not be, this is above like my level of experience, because I'm brand new. I'm a baby, in counseling. Yeah. So through that kind of then, I guess being kind of put into that vulnerable space where I felt like everything was on me. And then I didn't know what to do. It just kind of overwhelmed me. And so it kind of scared me away for a little bit, where I actually ended up having to, I remember the last day that I was there, I just felt so overwhelmed after my last session that I had. It didn't go super well because I had kind of botched some of the thing. You start the session, and typically when you first see someone, you go through the informed consent and the paperwork, and I didn't explain it very well because I was still new to it. And I just felt like I don't know what I'm doing. This is terrible. So I ended up calling one of my professors who was kind of helping supervise me in the program. And I just remember breaking down to her, and I was just like, I can't do this. Like, this is too much. So I had my own kind of breakdown of doubts and things that came into my mind about that. So my anxiety was really kicking up again. But she really listened to me, and she supported me, and she was like, hey, if you think you need to take, because I was like, I can't do this. I need to take the summer off, because it was during the summer. And I was like, I'm going to have to go home, kind of reset. It was that bad where
Good for you, though. Good for you calling it.
For sure.
That's
and I was,
brave.
Yeah. And so I think in the moment, I didn't see it as brave, because I was like, to me, I was like, I'm just running away. I'm just being a coward in that moment. But that's why I share this story with people, because it's like, I think a lot of people, when they fail, we're so scared of failure, we're so scared of those things that people don't normalize it enough. So that's why I share this story. But again, long story short, I ended up having to, so I would say Professor Navalon, though, the one who listened to me, she was a big part of why I even came back and finished the program.
Yeah.
And she really listened to me when I needed it. And then also just taking that time off. I went and worked at a summer camp that summer, like super random pivot, but I was like, go back to something that something that I like to do. I was driving boats, getting paid to drive boats and teach people how to wake surf and stuff.
Yeah.
So I had some fun, but I kind of had to hit that reset button. And then I came back. And so I'd say honestly, like coming back to that was a big moment for me because I realized, I did come back, I did finish it. And I think that it took that experience for me to kind of get some of those last pieces of my own anxiety kind of out and kind of prove to me that I was actually more resilient than I thought I was. And then that made me want to pass those kinds of lessons and things on to other people. So I'd say that was honestly like, it was a huge, it was not a very fun thing to go through, but I will say I can look back on it and say, I think that's really what the Lord knew that I needed to kind of get me to where he wanted me to be. So
I really like that. And I think it's such a great point because I think that, like you said, we're so afraid of failure and you see what you look for. And so it's so easy to like look at our experiences and be looking for signs that we don't belong or we're not right for it. Or, we're just kind of testing ourselves constantly. And I think that that's such a powerful story because you needed a reset. You didn't need a pivot. You just need a reset. And so the last episode that we recorded was a gentleman with Tourette's, and he talked about like take your 10 seconds. So the idea that like I don't have to ask for permission to introduce myself and tell people about my condition if I feel like I need to in a setting. And so almost like adding on to that, like take your reset. If something happens in your life, think about like how old you guys are, how old I am right now. If we stay in this career, we're going to go through things like loss and trauma and grief and whatever, and take your time. Take your time to bounce out and come back again when you're ready. And that's normal and that's good. And, I think that we have to normalize that in this field.
Absolutely.
Oh, yeah.
I think that's especially important for us as men to be able to do as well. I think there's perhaps even an extra societal layer of, what if I need to take a break and I'm not bringing home the money?
Okay.
Am I not supporting my family? Am I not fitting that role well? We are human.
Yeah. Permission to be human.
Yes, we are allowed to rest. I think that's a beautiful example of self-advocacy that led to further health.
Yeah.
Yeah, I like that. And I think that nobody seeing you now, Brandon, as clients would guess that, about you. And I think that's something that like is so powerful about like therapists. Of course, self-disclosure in a therapeutic setting is so nuanced and everything. And so I think it's important for us to have these conversations outside of that as well. But I do think that, we know where we've been. And if we can be gentle with ourselves in our learning process coming into the field, why would we not be gentle with ourselves in the field as well? So thinking about being in the field and being therapists, what would you say is the hardest part about being a man and a therapist?
Great question.
That's a good question. Yeah. I mean, let's see. I think for me, one of the things, well, maybe it was more kind of going back to when I was in the business program. Maybe what took me some time to realize was that being an empathetic person and being someone who listens well and does all those things, I think sometimes people kind of just automatically say, well, that's a feminine trait.
Oh, okay.
So I think I struggled for a long time, I guess, as I was coming into the role of thinking like that those were strengths. Because that's why maybe like in my business classes, right, empathy is my number one. And I was kind of like, oh, man, like I'm empathetic, I'm soft, right?
Okay.
Because in that sense, people are kind of like, really? Like you care about people's feelings that much? And maybe you're too sensitive and you're going to get rolled over in business, right? Again, that's not necessarily true, but that's what was kind of, that's what I was feeling.
Yeah.
And so I think there can be some times where maybe, if I start comparing myself to other people or that are in other fields. Maybe I can say, man, like I'm not doing a traditional field, or people could question like how hard are you actually working? You just I've heard that comment where people say you're just sitting and talking to people. How hard can that be?
Yes.
Right.
Yes.
I'm like, oh, okay, so maybe I am being lazy, or maybe I did take the easy way out, or whatever you want to call it. But I think there were times where, for me, I guess comparison can really just steal your joy.
Yeah.
But it's taken me a long time, and I think I'm in a place where I really can say, though, but those things, those talents that God's given me, and those things God's put me through have given me these strengths.
Your superpowers.
Yeah. And now I can use that to show other people that they have those same strengths. And so sometimes too, when I'm counseling some of my male clients at the college too, some of them will say the same thing, like, oh man, I feel like, I'm so sensitive, or this, and I'm like, or, a lot of times I like to ask people that in my first session is, what are some of your strengths? I'm like, I know that sounds like a business question.
Yeah.
But I want to see if they can identify what things they have. And sometimes they'll be like, well, I guess like people say that that I'm a good listener, or a lot of people come to me with their stuff, and I'm like, hey, that's kind of rare.
Yeah.
That's rare, especially these days. Like a lot of people just worry about themselves, or they're not very warm and empathetic. So I said those can be your superpowers. And I think it took me realizing those things about myself to also be able to share that with other people. And it's really cool when you see that kind of click for them, like, oh yeah, like you're doing this and you seem okay. And I'm like, I'm okay, I guess.
Yeah.
So.
I like that. It's like a redefining, manhood and masculinity. Like it should be the whole person.
Yeah.
Like girls can get angry, and like men can be soft and sweet, and it's still very strong. And and I think for people who have empathy, we're always the people that are like, everybody has this. Everybody can sit and listen. Like, what do you mean I'm a good listener? And it's like, oh no, other people have to learn to listen. And it's not until you're practicing in the therapeutic setting you're like, oh, this thing that I do that comes easily to me, it's special. Yeah. And okay, how about you, Carrie?
Yeah, I can definitely relate with everything you just said, so I'll just say that.
Because you're so empathetic and kind and welcoming too. Yeah,
so just retweet to everything you just said. Just copy paste, same exact. I can empathize with your empathy for sure. I think something else that stands out for me is there can be a lot of countertransference from some of my clients just by the fact that I'm a guy. I'll have lots of people come in first session, their body language is very closed off, very kind of unsure. Perhaps presenting problems include trauma that's perpetrated by a male. And that has been so scary for me, because that is a beautiful opportunity for a
redeeming experience. If they're ready.
Right? But the simple fact that I'm a dude can be a barrier for other people, for my clients.
Not to mention, like, bring into the room that you're both white dudes.
Right.
Right.
You're both white dudes. And so, there's a lot of like inherent privilege, with that position, and a lot of abuse of power that people experience. And so,
True.
Absolutely.
Yeah. So it's like walking that line of, is this the healing thing for them? Do they need a referral? I've only had to refer out one person who was triggered by the fact that I was a female and they had abuse as a male from a female.
Right.
And I had to review them to men. And I remember being like, oh, this doesn't feel good. Like, I've never experienced this before. And then I was like, wait a minute, my male colleagues experience this a lot.
Yes.
Because I get their clients. And so I think that's a really powerful point of like, you are exactly the perfect fit for a lot of people and exactly not the perfect fit.
Right.
Just by being a man.
Right.
Yeah.
And it's when it is a corrective emotional experience, when it is an opportunity for someone to say, I'm going to take a risk on you, Carrie. I'm going to try trust. I'm going to try rebuilding safety with men. It is
the best.
It is so beautiful. It is so energizing to me. Yeah, I think something else that can also be a little difficult is when some of my younger clients come in that are guys.
Yeah.
And they're struggling with, well, and I'm sure you see this a lot in the college setting, the questions of how can I be a successful man? Does that mean I have to do NFL? Does that mean I have to like craft beer? Does that mean, right? The
Grow a beard.
stereotypes,
Yeah.
right? Get it big, get it bushy.
Wow.
And again, I think by it simply being a male therapist, that fact in and of itself provides opportunity for a corrective emotional experience.
Yeah.
To say men, I mean, look at David in the Bible, right?
Yeah.
He was a warrior and he was a poet.
Yeah.
Yeah,
It
the
is
Psalms.
both.
Yeah.
Yes.
Yeah.
Yes.
Yeah.
Yeah. So kind of, again, it's like part of our work is people bringing their whole selves
Yes.
in, which looks different with our male clients than our female clients, and, you know, other identities as well. And we have to make space to do that as well. I think one thing, you know, as a female, is kind of the opposite of, you know, I can have an opinion and I don't have to be just soft and sweet and small all the time.
Yes.
You guys will laugh at me. I had a dream. It was like a month ago, and it was a very weird dream. Okay. So Michelle Obama came to me in my dream, and I may or may not send her a message to thank her, but which I'm sure she won't get. But she came to me, and I was sitting with my husband in like an auditorium, and she pointed at me and she said, you know, Tiffany, I see you, and I know that you feel like you have to take up as little space as possible and be small, but I want you to know that there's plenty of space for you and you can be big. And then I woke up and was like, Michelle Obama came to me in a vision.
Wow.
Okay.
She was right.
Thank you, Carrie. Thank you, Carrie. But like for you, like, you know, what are those messages that you feel you've kind of discovered, you know, for yourself? Because it's easy for me to be small. I mean, I'm like 5 foot tall, like literally. I could be small. I could fit anywhere. But I think as men, you know, the messaging can often be really different.
Sure.
So what kind of messages have helped you, you know, or you feel like you're still kind of learning to say to yourself?
Yeah. One thing that pops to my mind is I try not to overcompensate to be safe.
Okay.
And that even plays out in the physical setting of my office.
Yeah.
I grew up in Alabama. I love to hunt. I love to fish. I have the most beautiful mounts that I would love to bring into my office.
Yeah.
But then I have to think about, would that feel safe for all of my clients? Would that be me enforcing this aspect of masculinity? And I really wrestled with that, even with just the decor of my office. But at the end of the day, I came to the realization of it's just about providing safety.
Yeah.
I am safe.
You are safe.
So
Yeah.
if there's a deer head in my office or not, either way is okay.
Yeah, there's no like right or wrong choice. They're just
Right.
choices.
Right.
Yeah, because you're a very tall, kind of
Yes.
broad-shouldered
Yes.
guy. And I can see that, like, maybe, you know, that impulse to be like, I have to be like small and soft and, you know, whatever. And you're kind of a big guy too, you know, kind of broad-shouldered and pretty athletic. And so, so maybe it's a little bit of the same
It
of
is.
like, I don't also have to be small. I know who I am. I know I'm safe, and they'll know too.
Absolutely. And
I
think,
really like that.
I think part of the kind of dark history behind the reason why there now is more of a female presence in the therapeutic setting is unfortunately because historically there was a lot of abuse of power by male clinicians many years
Oh my
ago.
goodness.
Yeah.
All of our major theorists, like,
Yes.
stop dating
Oh,
your clients.
It's
like,
horrible. It's horrible.
Yeah.
Where
Or your
their code
research
of ethics?
assistants. Yes. Yeah.
So wanting to make sure that that's not even a thought for my clients, wanting to make sure, like I've many times throughout my life volunteered with youth group at my church or events at church. And one of the child safety policy rules is a man and a child should never be in a room together alone.
Yeah.
But in a professional setting, that's kind of a necessity.
Absolutely.
So being able to say, even to myself, like, yes, there is good reason historically why these rules exist, and we celebrate them and we enforce them.
But I'm not unsafe.
But I'm not unsafe.
Yeah.
Just because I'm a male doesn't mean I'm unsafe.
I don't have to convince anybody. Yeah, I just have to be me.
Exactly.
I really like that. How about you, Brandon?
Yeah, that's a good question. I think for me, what I've kind of had to come to realize was that, you know, again, I think this kind of pops up as sometimes imposter syndrome.
I feel so deep in that.
That's the thing, right? Like imposter
I'm
syndrome.
so deep in that, like right here in this room at this table with two of the safest people ever.
Yeah. So it's crazy because I think imposter syndrome is just such a human thing, right? Of just feeling like I'm not good enough.
Yeah. People will figure out that I don't belong here.
Exactly, right? Yeah, like I'm a fraud. Like, you know, I think maybe that's one thing that sometimes maybe clients almost like give you too much credit, not like in a bad way of I don't know anything, but sometimes in my mind I can almost, you know, when I compare myself, or I'll be like, man, like maybe I don't remember something like right off the top of my head, or someone asks me a question and I'm like, I don't know exactly how to answer it right on the spot, like right, you know, with the perfect words. And so sometimes I'd be too perfectionistic about that, I guess. And so I really had to kind of learn the message of, and I remember someone told me, it was my supervisor, Amy, she sat me down and she said, I was kind of venting to her one day and I was like, sometimes I feel like I don't remember what I should, or I don't know what to say here, or this or that. And I guess I was just kind of beating myself up that week a little bit, feeling that imposter syndrome. But she kind of reminded me, she said, but there's always going to be somebody who knows more than you. There's always going to be somebody who, you know, specializes in this or that, who has the techniques down better than you. But she said, but no one else can ever show up like as you better than you. And so it was just, again, leaning into the individuality of God gave you very specific talents and abilities and experiences to relate to people in a way that nobody else can. And that's the thing I think that's so beautiful about counseling too. And of course, it's also one of my strength is individualization, which is, it's basically just really resonating with people's individual stories. Because even knowing that, you know, we do group people together based on necessity of like, you know, like men, right? We're talking about men in counseling, but even then, right? Like we're
so
both
different.
men, but we have such different stories, even though there might be a lot of overlap. When we both have those individual stories that we share. So that's why I love approaching each of my clients the same way too, of, so how are you experiencing anxiety? How are you experiencing depression? How are you experiencing whatever you say that
Instead
you're
of
experiencing?
assuming.
Yeah, because I could say, well, anxiety, we know there's a cluster of symptoms that you're experiencing. But like, how are you experiencing that? It just helps you relate better. And so I think that was just a really, a message that I needed to hear at that one point, to say kind of like, there's always going to be somebody smarter than, better than, you know, depending on whatever criteria you're trying to use.
But no one can be you.
Yeah, nobody can be you, you know? So.
Well, and the research shows that the benefit of therapy is largely presence.
Yeah.
What is it, like over 70% or something? Or 80s?
I think it's 80.
Yeah. And so, you know, I think that that's one thing I think you're really great at, Brandon, is presence. Like you just kind of like sit down and like the air kind of like, you know, goes down in the room, and it's like, all right, it's going to be okay, whatever it is.
Yeah. I think I really focus on trying to make people feel that, you know, just basically that shame has no place in the room. Like once you walk in that door, like shame doesn't have any place, and whatever you're going through, experiencing, like I'm still here. I'm not going anywhere. And I think like you know, people just need to know that. It's like with you saying you really wanted to have people that were experiencing psychosis or suicidality or whatever you're dealing with, that's very stigmatized. That like, you know, somebody could be having active psychosis and you're just like, hey, I'm here with you. You're a human being. Yeah, come on in.
Well, and I think you guys bring like a really soft confidence into the spaces you're in, which I think is really important for people like, college students, what a high distress population. And they need somebody to like not be alarmed because they get so much pressure from so many places. And if like you're not concerned, I can remember sitting with a client a couple weeks ago and I was like, I am unalarmed. I want you to just look at my face. This is me, unalarmed. Like, this is not surprising to me.
They're almost
this
waiting for you to
it's just like, it's like,
how could you do that?
Unalarmed.
Yeah.
Like, what do you want to do with it? And so I love that. So what would you say is like the most rewarding part about being a therapist? Because that's what keeps us coming in every day.
Wow. Oh, there's so many.
Yeah.
There's so many. It's such a hard question.
We'll need a part 2.
Well, I know, I guess I can start. So for me, especially recently, I think just the most rewarding part for me is seeing the progress that my clients make, especially being in college, because you kind of have like a set time with them, and then usually
and it's so different, right?
Yes.
18 to 22 is everything changes.
Yes.
And even from year to year, semester to semester, can be so different. Or
they even look different.
Yeah, even the same client could say, first semester, I really want to work on personal development. Second semester, like my grandpa passed away, and so I really want to focus on that. So it can be lots of different things, but I love seeing the growth of the students from freshman year to senior year, and then like you just feel so proud when they like finally make it through. And so I remember there's different clients that where they've really had struggles, and I've kind of to this point really just been with them for multiple years now. That have been there multiple years. So now it's kind of cool to see some of those transformations and progressions that students have gone through. And just to see like them light up on like, wow, like I am using everything we've just talked about for the last 2 or 3 years, but actually being able to see the end result. Because I think sometimes as counselors, it's really hard. There's a lot of people that we see where we'll plant seeds or we'll do a little bit of work, but we usually almost never get to really celebrate successes with them. So
you don't get to see them like exit a developmental stage. Or
I try to think of some of my own therapy, like counselors I met with, when I was younger, they don't see my finished product of now, at least, and some of the work that they did to help me get there. And so I try to think through that. And so, sometimes some of my clients they've written me letters after the fact, or they'll check in afterwards or something. And so I think cool. I think at one point you kind of told me, hey, you need like a rainy day folder. And so smile file. You told me to make a file literally with things that clients have given me, or just things that make me remember, oh man, I remember that person, and like how they first presented to me and how just defeated they were. And then how we stuck with it together on that journey. And then you see the progress. And sometimes too, those thank you letters they seem so like you want to just deflect all of the praise, because they're like,
you did it. You did.
Thank you so hard. They're like, thank you so much that like you did this for me, or you, and every time they say that, I'm like, well, like I was just there with you. You did the work. Like I'm so proud of you for doing that. But I'll still, it is really nice to hear when they've done the progressions and they've really grown. So even if they don't say thank you, just seeing the progressions, and
that's the thing.
When you're blessed to be able to get a glimpse of that, to me that's been like super rewarding, and those help make up for like the bad days where everyone just seems like they're struggling, and you're like, what am I even doing? Am I being effective at all? So those, for me at least, like recently, that's really what's been keeping me going.
That's awesome. Because you're coming into, like, you've been there so long that you're seeing some of the people that started at the university graduating, and you're like, whoa.
Exactly.
That's cool.
I'm getting to that point where I could be like, freshman year to here, we're getting there.
That's so cool. I love that. How about you, Carrie?
Very, very similar answer again here, but it's when a client achieves a goal. That when they first sat down in my office, that very first session, it was, well, here's this almost like Sisyphus feeling task that I'm never going to be able to ever get to the other side of. And they do it.
They do.
They do it. And recently I've been going through my EMDR training and certification.
High five!
The best. Love it.
Yes.
Have my second part training next weekend.
Oh my goodness.
Shout out HAP. We love HAP EMDR
love it.
Institute. It's the best.
Yes.
But
I did PTI, so also shout out to that too.
PTI is also incredible.
Represent both.
Yep.
Yeah.
I guess I'll have to choose when I do it.
Flip a coin.
Okay,
All right.
we have so much lobbying to do here.
Okay,
Yeah.
We'll do that
the
off
air.
air.
We'll talk. We'll talk after this. Yeah.
But EMDR
Brandon's
has been,
like blocked numbers.
he's like,
it's
and
too much.
not following. But with EMDR being it's just such a different therapeutic approach.
Is so good.
But the healing that comes when you get to that last phase, and then the client sits on the couch and says, I'm light.
It's just not there.
This is not present anymore. It's healing is just such a beautiful thing. It's just so beautiful, and I really feel like, and I'll joke with my clients all the time. I'll say, you know, similar to what you were saying of tell me about your strengths. Sometimes we'll shift to let's talk about your growth. Let's talk about what has happened since you've started here. And usually when I first bring that up, there's a little confused look of, I'm in therapy. We're here to talk about the hard stuff. Like, I don't want to talk about what's going well in my life. But what we pay attention to is what grows, right? What we behold is what we become. So getting to see clients shift focus towards health, I just want to like dance every single time that it happens.
Yeah.
I love that. Yeah, I always say it's the best job in the world.
It is.
Yeah. One of my clients, she's always like, oh, I don't know how you do this. How do you listen to people complain all day? Well, I don't listen to people complain all day. But it's the best job in the world.
Yeah.
Yeah. Okay, so I have 2 last questions for you guys. What would you say to someone who's maybe listening, thinking about starting therapy and starting that process? Like, what tips or advice do you have for them in finding a therapist, starting that process? It's so scary and daunting, and your first therapist might not be the one that you end up using. So what kind of advice do you guys have?
Sure. I always encourage people to start from a position of you are the expert on you.
I like that.
You know what you need.
Yeah.
You know what you are hoping for. Give yourself the freedom to try and the grace for it to fail. Like you said, the first therapist may not be the best fit.
It's like buying shoes.
Yeah. If it doesn't fit, it just doesn't fit. You can try another one. I encourage
and therapists
people,
are okay with that, guys.
Yes.
Like,
we give you
we don't
permission
mind
to
if
do
you
that.
find a better fit.
and we can even help.
Ask that therapist for something else and tell them what doesn't work.
Yes.
And a good therapist will empower you and help you find that fit.
Absolutely. One of my favorite go-to resources is psychologytoday.com.
Yeah.
You can put in your zip code. You can see our smiling faces. You can see specialties in education. I also encourage people to consider, so in the realm of therapy, there's a lot of alphabet soup, right? There's LPC, there's MFT, LPC, MHSP, there's PhD, PsyD. There's a bunch of alphabet soup. Just set that aside. Set that aside. Interns are educated. Pre-licensed professionals are equipped.
Yeah, I like that. That's great advice, because sometimes they think they have to get that licensed professional. Remember, unlicensed professionals are supervised by a professional who's been in the field a really long time.
Exactly.
So they're getting you almost get 2 for the price of 1. Because you get that person and their presence and their abilities and their skills, but you also get the abilities and skills and advice of who they're seeing. And then also, if they're in a consultation group, which is how we met.
Right.
We met at Valley.
That's how we continued our friendship.
That's how we became friends. I mean, I don't think you knew we were friends before that, but
were.
I had already
We were.
Yeah, we were. Thank you for saying that. Sometimes I have decided before the people, but I think we tracked together on this.
We were on
one.
the same page.
There you go.
Yeah, but I think that's great advice. Find the person, find the approach. And a lot of times in Psychology Today, they have the person list, talk about their modality and their specialties, so you hear their voice. So I think that's it. Find the person, try it out. It's an experiment.
Yeah. I would also say, again, it's okay to do it scared. It's okay to be scared. I remember
I like
my first time going to my, my first clinician Side note, every good therapist has their own therapist, y'all.
Sure does.
Stand behind that.
Sure does. Yep.
But one of my first times going to my new therapist in Chattanooga, I think I pulled over to like 5 different gas stations on the way there just to be like, oh, I'm anxious, I'm sweaty, am I really about to go talk about all this hard stuff?
Oh, yeah.
And it was hard.
Yeah.
And it was worth it. It is okay to be scared.
I like that. Do it scared.
Yeah.
Do it scared. That's such good advice.
Yeah.
How about you, Brendan?
Yeah, for sure. Definitely, again, kind of retweet all those things that you just said. Because, I think that it's good to give yourself permission to try, to just do. Because, sometimes it's also asking yourself, well, it's scary to do it, but also how scary is it to continue on the path that I'm on?
Ooh, pick your
and
heart.
if that's, which one's harder to do the hard thing of meeting someone new. So it's just giving yourself grace and that permission to try. So I really resonated with that one especially too. But and kind of going along the same lines, I think it is really just about just finding the person who you really vibe with, finding the person who you just connect with in a therapist, because I think there's evidence out there that suggests that the therapeutic relationship or the bond that you have with your therapist as an individual person is like very much the factor of successful outcomes in counseling, even more so than the specific modalities or techniques they use.
So true.
So not that those are not important.
Right.
Sure.
Yeah. Someone who's trained is good.
Yeah. So definitely, professionals.
But if that rapport is not there, no matter if they're Houdini,
but that's the bedrock, that's the foundation. If you don't have that foundation of a good relationship, or you're just like, they give me good advice, but I really don't relate to anything else about them, that makes it harder to buy in, because then you're like, well, that was your idea, not mine. So it's good to find someone that you really have that therapeutic relationship with. So that's.
I like that. Yeah.
Those
So,
are good things.
You don't have to eat plain yogurt, right? You can, get some fruit at the bottom or like put a little granola in or something. Yeah. And I think too, there's, the therapists that I know, they're delightful people. They're funny and fun, and like, this has been fun, and we're just 3 of them. And so I think that, it doesn't have to be really daunting and formal and scary. Yeah. It's okay to bring yourself in and to connect with that other person as well. So how about people who are thinking of coming into the field? Any advice for that?
Yeah. I mean, so I guess for me, the advice that I would give is, kind of like we talked about before, one, make sure you do your own work before you do it. Because I think we saw, even through my story, like there was even things as I went into the program that I still needed to work through, which was okay though, in the sense that the program kind of does help safeguard that too. They won't put you out if they don't feel like you're ready.
Absolutely.
Yeah. Trust the process.
Yes.
Trust your faculty.
Yes. So they're also there to safeguard you and safeguard anyone else out there who could potentially be hurt if you go out there and you're not ready. So they're invested in you as a person. So, but I would say like do your own work and really question like what are the motivations for me wanting to do that. But I would also say too that I guess it's like some of the things we were talking about today, right? So just giving yourself permission to do it scared. So kind of similar to as you're going into therapy, do the same as if you're going into I mean, we talked about how hard it can be going into counseling in the master's program, because you will be doing a lot of practice with your
a lot of
classmates.
Yeah.
And then I remember, there was classes. There was classes where like abnormal psychology, our professor was a psychiatrist, and he would literally sit in the front of the room with a chair across from me. He's like, all right, you come up here, sit in this chair, and I'm going to pretend like I'm the client, and he's just going to throw stuff at you, and you're supposed to ask questions. And so it's very much about making yourself uncomfortable. But the beautiful thing about that is, I think, like, again, if you have a safe cohort, which I feel like, I had when I'm sure you would say the same thing. Yeah.
Yeah. So counselors are often good folks.
Yes.
For sure. So it's a good, you're in a good group of people to be vulnerable.
It should be. It should always be that way. It should always be that way. Yeah.
So you're in a good group though, where you can be a little uncomfortable, and it's good to do that where you have kind of those safeguards and you're doing it with, getting those things out first, and then you go to experience them with clients and see yourself grow. But I mean, I will say, kind of like we've been talking about, it is such a rewarding thing to do.
Yes.
And so if you are feeling that call on your life, or you're just really feeling interested in, you know, I want to help people, and this could be definitely a great way to help people. And that's the thing, right? Like, as much as we like help other people, again, whenever they say, oh, thank you so much, I'm always like, I'm here with you for an hour out of your life, out of the week. You're with yourself the other, how many other hours are in the rest of that week?
Great point.
But it can have such an impact on myself too. So again, it's a mutually,
hear ourselves sometimes. Like, I hear myself all the time, and I'm just like,
yes.
Note.
Yes. Yeah. Like when
Talk
someone
to myself
says
later.
Yeah. Like I just told you my story of how I had to kind of quit and go back.
Yeah.
I just had a client who was going through similar things where they were just really doubting themselves, and like, you know, I don't think that I'm going to make it. And I was like, I see so much of where I was before I came to where I am now. And so I just really encouraged them. And again, seeing that like success though with them was really cool. And it's even cool to just think how God prepared me for where I'm at too, because literally the building that I have my office in at the school wasn't even built yet when I was still going to school, and I had no idea that the building that I saw being constructed was going to have my name on the door.
How
like
cool.
Oh, Brad.
So it's just so cool to like look back and see how that happens. But so I would really say though, like, because again, I almost ran away from it like once or twice, but I came back because I feel like God really called me to it. And so, if you're interested and you've done the work and you really have that motivation to help people, like, it can be such a rewarding thing.
Yeah, and it sounds like, you know, therapists cast the hope for their clients. You know, it's okay to let people cast hope. Like your professor cast hope in you and believe in you in front of you so that you could like take another step back. And so if you're thinking about, you know, coming into the field, you know, find those people that are empowering to you, and then like save them as your favorites, because you're going to need them. Because I think it's like silly to think that at some point in any graduate degree, you wouldn't have some doubt of like, why am I doing this again? And like, so you have to have those anchor points of people who see you. Yes. How about you? Advice?
Yeah, I would say the advice that I was given by a dear friend, her name's Mary Ellen. She was my boss at the nonprofit I worked at.
Okay.
And she was an LPC.
Okay.
And I remember sitting down in her office one day saying, you know, I love my job, and it was a scary, like, you're my boss. I don't know if I want to tell you this, but she's the best. I was like, I think I want to go for my degree. I think I want to become a therapist, to get into counseling. And she said, what's your why?
Ooh.
She said, Have you spent time thinking about that? I was like, well, here are some reasons. She was like, those are good reasons, but what's your why? So she encouraged me, you know, just take some time, sit back, prayerfully consider that, talk with friends, talk with your support system, figure out what other people see in you for this too. And that was such an encouragement to me. I also encourage anyone who's considering this to realize to spend a little time understanding the commitment. So typically you're looking at least 3 years for the degree itself after you've completed your undergrad degree. Then after you finish those 3 years, you're looking at usually around, at least in the state of Tennessee, usually around 2 years after graduation.
Georgia, I think it's 3.
Before you can accumulate all your hours and supervision hours. Then you have your 3 exams for licensure.
Right.
And then after that, y'all, it doesn't stop.
Yeah.
You have continuing ed you do every year. You have to reapply for your license. There is a lot to the business side of counseling that I think sometimes if we're not aware of that, can take us by surprise.
Need to carry malpractice insurance.
Yes, malpractice is important. You know, there's a lot that goes into it.
It's not just sitting with people.
It's not.
There's
getting paneled with insurance panels, not taking insurance. Do I take insurance? There's a lot of decisions that come even after you graduate. But I don't say that to scare anyone. I say that to say you're going to be equipped to make those decisions.
Go eyes wide open.
Yes.
Yeah.
Yes.
Go scared.
Yes.
Go eyes wide open.
Yes.
I'm glad you said that though, because it's true. I think I was maybe like halfway through my program because I didn't research the tail end of it. And I was like, oh yeah, so 3 years of master's. That's all right. I like school. I'm one of the rare ones who
I do
went to
too.
school for
Same,
like
same.
9
I love that feedback.
Yeah. So I was like, all right, that's cool. Like I'm cool with that. But then like you're done and you're not done.
You are
No.
not done.
Which I think is good in counseling because then they make sure that you're very well prepared when
Yes.
you're on your own. But yes, I'm so glad you said that just to have
Because
people
I think
do
a
the
lot of people
research.
don't know. I just
Yeah.
taught a class on theory, and I think one student knew that there was a residency after graduation. The rest were like, what?
Yeah.
Because when I graduate and then I get my license, and I was like, yes, also, you all know what's between graduation and licensure, right? Residency.
Couple of years.
You pay for supervision.
Yeah.
You have to go to a lot of it.
Yes.
You have people reading your charts.
Yes.
And it's good. And I think in a lot of ways it's comforting because what they told me when I was in grad school was you were going to graduate and be qualified to practice under the supervision of someone else. So if you feel like you're coming to the end of your program and you're still like, I don't think I know enough. Yeah, you don't.
And that's okay.
Right, because that's why we have this end of the process. But yeah, I really like that to kind of go in with an informed approach of like what you're getting into.
Yeah.
It's not as long as like medical school and residencies and all
Right.
those kind of things if you want to be a doctor, but it is more than, it's more than just, a few
Just the
years.
masters, yeah.
And
Yeah.
last thing I would say too is ask yourself, what are your current self-care habits?
Ooh,
Right?
yeah.
What are the healthy ways that you're resting well? What are maybe
Balance.
some unhealthy ways you're resting well? Because when you do transition into this profession, you're sitting with a lot of hard stories. And that takes a big toll.
Yeah.
So,
Yeah.
there will be days where I have, 8 clients in a day and then group
Yeah.
that night. And then
Yeah.
I get home and emotionally I'm spent. But I open that door and my little 14-month-old son looks at me and goes, "Dad, Dad, Dad, Dad."
Yeah.
And I never want to be so spent
Yeah.
that I can't lock eyes with him and smile and be present for him and my wife. And self-care is a necessity.
Yes.
So I
Yeah,
encourage
because you're the
people-
instrument.
Exactly.
Your body, your
Yes.
brain.
Exactly.
And I think that when we get close to burnout, it's where I see counselors struggling with, questionable choices and questionable like behaviors and
Yeah.
things like that is when they're not taking care of themselves. Their caseload's too high.
Right.
Yeah.
In private practice, I think there's a lot of people really maximizing their caseloads and like, yeah, we all want to pay off our student loans, but like, you have to kind of think
At
about
what cost?
Exactly.
yeah, at what cost and
Yeah.
being healthy and so one thing I've started for myself is I've taken like my exercise classes and the stuff I do with my family and I put that in my calendar, my clinical calendar first.
Good.
I like that.
And then I can only fit meetings and clients and,
I love that.
around that. And Brandon knows I like to have my fingers in several projects at the same time.
Yeah.
So I have to really be like strict with myself about like, it's hard to say no to good things, but
Yeah.
yes and no are two sides of the same coin.
Yes.
So, what are you saying yes to and what do you want to be with the people that matter the most, which is our families, our friends, our
Absolutely.
relationships.
Yes.
We can't be giving our clients the best of us and our family the leftovers.
Right.
But we also can't give our clients the leftovers.
Right?
So
How do we
whatever we're
serve
doing.
both?
Yes.
Yeah.
Yes.
Yeah.
Yeah.
So, yeah, maybe you give your lawn your leftovers or your laundry gets your leftovers or whatever. I don't know.
Yeah.
But okay, any last thoughts? Anything that you wanted to share that we didn't quite get to?
Really I just wanted to take a second just to say thank you for having us on here today.
You're
This
so
has been so
welcome.
much fun. And yeah, I think one thing I want people to take away is that your therapist is a human, right?
Yeah.
Even your male therapists, we're humans too. And if you're a male who's considering becoming a clinician, you're allowed to be anxious. You're allowed to
Yeah.
have your own struggles. You're enough. And that's what we act out of.
Yeah, your humanity is the best part of you.
Yeah.
It's the most interesting, most useful part of you is that fallible self.
Absolutely.
I love that. Yeah. Thank you for that.
Yeah. And I guess I would just add too, like I said, just kind of speaking to my younger self, and I would say to everyone else too, is just really take the strengths that God's given you and the talents that he's given you and really try your best to recognize them as that. Because like we were talking about, being a male sometimes in that space, maybe it's going against what everyone else
societal norms.
Societal norms, right? It's
Yeah.
not the typical gender roles that you have. It's like, oh, you're empathetic and you're emotional. Like, I cry. Like, sometimes some of my clients, it makes me kind of tear up. And so that's the thing, right? We're human. We're malleable. But you can be empathetic and strong and all of those things at the same time. But I just want everyone to, and all of my clients or just anyone who might be listening or any of those things too, to just really see those good qualities of yourself and try to learn how to see them as strengths and then utilize those strengths. And it can be so fulfilling when you do. Maybe a therapist can help you see that too.
Yeah.
And I know for us, it all took people speaking in our lives as well. So basically, I guess the last message is just like, you don't have to do life alone. And so whether you're going to become a therapist, whether you're thinking about going to therapy, the whole message I think we have was, you don't have to do it by yourself. And just rely on those people that are around you and all of those different things. So, yeah.
I love that. You don't have to do things alone. You can do them scared.
Yes.
Yeah.
Yes.
And we're just humans sitting with humans. We don't have it all figured out either.
No.
We just know a little bit more about a few things.
Yes.
And,
That's it.
and I always tell my kids, we're stupid about our own stuff. When I'm feeling some kind of way or I'm not feeling like, settled in my life, I have to go talk to somebody.
Yeah.
Because, permission to be human.
Yes.
Yeah.
Yeah. Thank you guys so much for being here. I just have so much respect and admiration for both of you. And I was so excited that you guys would be here in this space together. And I think I've felt so much warmth and comfort from the very first time of meeting, each of you in totally different places. And so I'm excited that, we get to be in this field together and in the helping profession. And I want to thank everybody who's listening and watching. Thank you for being in this conversation too. Just to kind of echo what the guys said, you deserve support. It's okay to face hard things, but you don't have to do it alone, and it's okay to do things scared. So, you heard their stories and in our conversation, and maybe it's making you think about your story or conversations you'd like to have. So make sure to find those places where your stories can be heard and held, and we'll see you next time right here on How Would You Rate Your Pain? Thanks for listening to How Would You Rate Your Pain? Please subscribe on your favorite listening platform so you never miss an episode. And if this show made you think of someone, please share it with them to help us grow. I'm your host, Dr. Tiffany Bartell. You can find me on Instagram at the_happy_therapist_. This show is not intended as medical advice and should not take the place of therapy or other mental health services. Please consult with your doctor or mental health provider about your own health. You deserve all the support. How Would You Rate Your Pain is co-produced by Wavelength Studios and Chattanooga Podcast Studios and is part of the Podnuga Network. Graphic design provided by Josh Wilhelm at JW Creates and music by Michael Crosa. I'm Dr. Tiffany Bartell. Thanks again for listening. We'll see you next time right here on How Would You Rate Your Pain?